Hi, I'm Dr. Alexandra Otto. I'm a board-certified pediatric dentist and the co-founder of Alcan Dental Cooperative and Kids Tooth Team Pediatric Dentistry. We've absolutely loved working with Jazz Sensors and their company. They're very easy to work with and their customer service is outstanding. Because of that, we're so excited to demo some of their products with you today. Choosing the right X-ray generator, wall-mounted versus handheld devices. The great thing about Jazz Sensors is that you can use a wall-mounted or a handheld generator device for your X-rays, but there are some differences in the two that we'll discuss in the session today. For wall-mounted devices, you do typically have to leave the room to capture the X-ray image, so one of the great things about a handheld device is that the operator can stay in the room while taking the image. This is important for our pediatric, geriatric, or anxious patients because it allows the operator to quickly take the X-ray without leaving the room. This leads to reduced time overall in taking the X-ray, which is easier for the patient and can also lead to cost savings and staff time. The great news is that whether your office uses a handheld or a wall-mounted X-ray unit, you'll be able to capture great images with your Jazz sensor. We love that Jazz sensors also, in general, require less overall radiation to capture an image compared to older types of imaging systems like phosphor plates and film, making them safer for our patients. That said, there are some slight differences in handheld and wall-mounted X-ray units that could affect your image quality. So let's dive into a few of these differences so that you can properly use your X-ray generator and get the best use out of your Jazz sensor. First, let's discuss a couple key differences in the power of the two types of machines. Generally, handheld machines have lower kV or penetrating power and lower MA or amount of photons compared to wall-mounted machines. To compensate for this, handheld units often need a longer exposure time than wall-mounted units. Wall-mounted units, on the other hand, typically offer higher kV and MA, which allows for shorter exposure times. Depending on your machine, settings like exposure time, kV, and MA may be preset, but typically they can be adjusted according to which X-ray you are taking and the size of your patient. If the kV and MA can't be adjusted on your unit, the exposure time may be the only adjustment you need to make. We mention these settings because they are all things that can affect how your X-ray turns out. So it's important to know how to correctly adjust them on your machine to get the best high-quality image. A patient's bone density is one of the main reasons we have to adjust settings on an X-ray generator to get a high-quality image. A patient's weight, age, size, and area of the mouth where you're taking an X-ray all contribute to how dense the patient's bone is. An X-ray on a larger person in an area with more dense bone, like an adult bite wing, for example, will require more radiation and different generator settings than taking an X-ray on a child in an area of less dense bone, like an anterior PA. So adjusting the exposure time and settings correctly on your X-ray generator will make sure you get a high-quality image and are using the correct and safe amounts of radiation. Lucky for you, many of these things are already preset for you on most X-ray machines, so you're only going to have to press a few buttons correctly to adjust the settings for the type of X-ray you're taking and the size of the patient. Now, a couple quick pointers for troubleshooting your X-ray generator to help you capture the best images. If your X-rays are turning out overexposed, it would look too dark and saturated, whereas an underexposed image would look too light and grainy. To improve these images, we just need to lower or raise the exposure times on your generator to properly expose the sensor. For optimal results, always be sure to check the recommended settings for your generator and the Jazz sensor when pairing them together. If your images are coming out blurry, it's probably due to patient or operator movement. If you have a handheld unit, it's important for the operator to be as still as possible when capturing the image. Because we know that handheld units require slightly longer exposure times and an operator to physically hold the device, it allows for the possibility of patient or operator movement when taking the X-ray. Holding the handheld unit with both hands and a loose grip to keep the unit steady when taking the X-ray can help with this. Though someone does have to hold it, one of the great things about a handheld device is that it takes much less time overall to position the patient and take the X-ray because you don't have to leave the room to take the X-ray. If you have a wall-mounted device, it's important to instruct your patient to be as still as possible when capturing the image to reduce the chance of movement and blurry images. Because the unit's fixed in place, you don't have to worry about operator movement because no one has to hold it. But because it does take longer to position the patient and unit, and you have to leave the room to capture the image, there is a higher chance of the patient moving during all of that. So be sure to keep reminding and encouraging your patient to be as still as possible during the X-ray process with wall-mounted units.
Regardless of whether you use a handheld or a wall-mounted machine, these tips will help ensure that you're using optimal techniques for best image capturing and to make sure that your radiation doses are kept as low as reasonably possible to keep our patients and operators safe. Be sure to check out our other videos for tips on sensor positioning and placement for other best practices.
In general, a wall-mounted or handheld device is going to be great with your jazz sensor, but it is important to consider the specific needs of your practice when choosing a device.